Ventricular fibrillation, or VFib, is a life-threatening heart rhythm problem that occurs when the heart's lower chambers, the ventricles, quiver instead of pumping blood effectively. This chaotic electrical activity prevents the heart from delivering blood to the brain and other vital organs. Without immediate treatment, VFib can lead to sudden cardiac arrest and death. In this video, we'll explore the causes, symptoms, diagnosis, treatment, and prevention of this dangerous condition. Ventricular fibrillation often stems from underlying heart conditions. Coronary artery disease, where plaque buildup narrows the arteries supplying blood to the heart, is a primary culprit. A previous heart attack can also damage the heart muscle, creating an environment prone to VFib. Other contributing factors include cardiomyopathy, a condition where the heart muscle becomes thickened or enlarged, and congenital heart defects, structural abnormalities present at birth. Furthermore, electrolyte imbalances, certain medications, and electrical shock can trigger ventricular fibrillation. In a healthy heart, electrical impulses travel in an organized manner, causing the ventricles to contract and pump blood. In ventricular fibrillation, these electrical signals become chaotic and disorganized. Multiple, rapid electrical signals fire simultaneously, causing the ventricles to quiver instead of contracting forcefully. This quivering prevents the heart from effectively pumping blood, leading to a drastic drop in blood pressure and ultimately, cessation of blood flow to the brain and other organs. Without immediate intervention, oxygen deprivation quickly causes irreversible damage. Ventricular fibrillation is relatively uncommon in the general population, but its occurrence increases significantly in individuals with pre-existing heart conditions. The incidence of sudden cardiac arrest, often caused by VFib, rises with age. Men are statistically more likely to experience VFib than women. Furthermore, people with a family history of sudden cardiac arrest or certain inherited heart conditions have an elevated risk. Understanding these epidemiological trends helps identify individuals who may benefit from preventive measures. The symptoms of ventricular fibrillation are abrupt and severe. The most prominent is sudden collapse and loss of consciousness. Breathing stops or becomes gasping and ineffective. There is no pulse, indicating that the heart is not effectively pumping blood. These symptoms occur suddenly and require immediate emergency medical intervention. Any delay in treatment significantly reduces the chances of survival. Diagnosis of ventricular fibrillation relies on an electrocardiogram or ECG. This test records the electrical activity of the heart. During VFib, the ECG shows a characteristic erratic and disorganized pattern, confirming the diagnosis. In an emergency situation, this diagnosis needs to be made quickly by emergency medical personnel. Other tests, such as blood tests to check electrolyte levels and imaging studies of the heart, may be performed later to determine the underlying cause of the VFib. While there aren't distinct types of ventricular fibrillation in the same way there are for other heart conditions, the term idiopathic ventricular fibrillation is sometimes used. This refers to VFib that occurs in individuals with no apparent underlying structural heart disease. In these cases, genetic mutations or subtle electrical abnormalities may be responsible. The approach to treatment is largely the same regardless of whether an underlying cause is identified. The primary treatment for ventricular fibrillation is immediate defibrillation. A defibrillator delivers an electrical shock to the heart, which can reset the chaotic electrical activity and restore a normal rhythm. Cardiopulmonary resuscitation, or CPR, should be performed until a defibrillator is available. CPR helps maintain blood flow to the brain and other vital organs. Long-term management may involve medications to regulate heart rhythm, such as antiarrhythmics, and lifestyle changes to address underlying heart conditions. An implantable cardioverter defibrillator, or ICD, may be recommended for individuals at high risk of recurrent VFib. An ICD is a small device implanted in the chest that monitors heart rhythm and automatically delivers an electrical shock if VFib occurs. Preventing ventricular fibrillation focuses on addressing the underlying risk factors. Managing coronary artery disease through lifestyle changes, such as a healthy diet, regular exercise, and smoking cessation, is crucial. Controlling blood pressure and cholesterol levels also reduces the risk. Individuals with a family history of sudden cardiac arrest may undergo genetic testing to identify inherited heart conditions. Medications may be prescribed to prevent arrhythmias, and in some cases, prophylactic implantation of an ICD may be considered. The prognosis for ventricular fibrillation depends heavily on the speed of treatment. Immediate defibrillation significantly improves the chances of survival. However, even with prompt treatment, brain damage can occur due to oxygen deprivation. Long-term prognosis depends on the underlying cause of the VFib and the effectiveness of management strategies. Recent research is focused on improving the accuracy of risk prediction for sudden cardiac arrest. developing more effective antiarrhythmic medications, and enhancing the capabilities of ICDs. Additionally, researchers are exploring the potential of gene therapy to correct inherited electrical abnormalities that predispose individuals to ventricular fibrillation.